Hello, this is Ronnie Smith, Acting Director for the Ralph H. Johnson VA Medical Center, here for another video update of what's been happening with the VA and our facility in response to COVID. Several big things have happened since our last update, so I wanted to give you an update of what's happening. First, overall, just some of the numbers of our number of patients and employees that have been dealing with COVID. Right now, we're monitoring 8 positive veterans in an outpatient setting, and we currently have 1 veteran inpatient at Ralph H. Johnson that has tested positive for COVID. We're also monitoring 16 additional veterans for possible infection and following up with them closely to see if they need additional treatment or that they in fact become positive. This is a direct result of the increased testing that we have available to us, and we're providing out in the community in coordination with our primary care teams and also the veterans that come to our ED for an outpatient visit that need testing. We are expanding our testing capability in 2 different ways. On Monday, May 4th, we started drive-up testing at 3 of our community clinics in Savannah, Myrtle Beach, and Hinesville. Much like the drive-through testing we coordinated with MUSC in the greater Charleston area, we knew we needed to expand that testing capability to some of our larger community sites. So we're really excited to be able to offer that service to our veterans, and we're already seeing a few come in and take advantage of that service. This week we're also finalizing plans to start doing some testing for very high-risk procedures. These are big procedures where the nature of the case that we're having to do generates a lot of aerolization, obviously creating a higher risk for a possible spread of COVID. So we are going to begin doing some pre-procedure testing of patients that need those procedures, determine if they do have COVID before we have that procedure. We'll be finalizing that this week and beginning that testing immediately afterwards. We'll be asking those patients to come in a couple of days before their procedure, be tested, and we'll know the results before the procedure, and we can take the proper precautions if the person is tested positive. Another additional benefit and change is that occupational health or employee health now has a physician line that you can call if you have any concerns and want to talk to a physician directly and related to anything you're dealing with health-wise and related to COVID. The number you see on the screen here is the number you need to call, and that service is available Monday through Friday from 8 a.m. to 4 p.m. We continue to appreciate all the support that the employee health has been providing and helping coordinate and provide the best steps for our employees dealing with a possible illness, and also our supervisors helping coordinate so we can take the next step regardless of the situation. Employees can still continue to use the email displayed here if they want to choose that mechanism for communication as well. In addition, today we communicated out about the Families First Coronavirus Response Act. Please review that message for additional details. There is a fact sheet and also an email address that you can use as well if you have any questions about it. There's 2 leave entitlements in that. Both are fairly complicated, so please review the fact sheet very closely. Lastly, of the big announcements is starting May 7th, this Thursday, any person in the facility will be required to wear a mask. We've been about 95% there prior to this, offering masks to all of our staff. The big change here is we'll be expecting any visitors and veterans that come into the building also have a mask. We've been providing masks out front for those individuals, and an expectation going forward is that anyone we see in the public highway are wearing a mask that's covering both their nose and mouth. And so we do really appreciate everyone that's been doing this already. It's doing everything we can to keep each other safe, and it's just the right thing we need to be doing at this time. This week, we've been recognizing our nurses for National Nurses Week. It's been really great to go around and see some of our nurses and to thank them for all the great work they've been doing, especially related to COVID. We've been out visiting many areas of the hospital, and we'll continue doing that the rest of this week with activities Also, next week is National Hospital Week, and so we'll have a lot of activities prepared for that as well. And looking forward to seeing everybody in as safe environment we can. We'll be doing various things for our community-based outpatient clinics as well. So we're looking forward to all the fun we'll be having next week. And that is all I have for this edition, and we'll talk to you again soon. Please make sure you stay safe, keep that social distancing up, and make sure you wash your hands with soap and water. Thanks.